What is cellulitis? If your skin is unusually red, sore, or swollen, it is most likely a case of cellulitis. Cellulitis is a medical condition that you should not expect to resolve on your own. Cellulitis is a common and sometimes painful bacterial infection of the skin. It may first come out as a red, swollen area that feels warm and sensitive. Redness and swelling can spread quickly. The infection affects the skin of the lower body, but can occur anywhere on the body or face. Cellulitis is usually found on the surface of the skin, but it can also affect the tissues underneath it. The infection can escalate to the lymph nodes and the bloodstream. Cellulitis symptoms include tenderness and pain in the affected area, red or swollen skin, fast-growing pain or rash, tight, shiny, and swollen skin surface, feeling warm in the affected area, pus and abscess with fever. Such symptoms may mean that cellulite radiates laziness, drowsiness, blisters, and red lines. Cellulitis takes place when certain types of bacteria enter the skin through a cut or a crack. Staphylococcus and strep bacteria can cause this infection. The infection can start with skin lesions such as cuts, insect bites, and surgical wounds. Cellulitis is generally not transmitted from person to person. However, it is possible to contract cellulite if you have an open cut in the skin that touches the skin of an infected person. If you have a skin condition like eczema or athlete's foot, you are more likely to get cellulitis. Bacteria can enter your skin through cracks caused by these conditions. Since a weakened immune system cannot protect you against infection, your risk of getting cellulite increases. Any injury, cut, fracture, burn, or scrape gives bacteria an entry point and puts you at an increased risk of cellulitis. They weaken the immune system. Conditions that debilitate your immune system, such as diabetes, leukemia, and HIV/AIDS, make you more susceptible to infection. Some medications can weaken your immune system. Skin conditions like eczema, athlete's foot, and herpes and shingles can cause breaks in the skin, providing bacteria with an entry point. If your cellulitis recurs, your doctor may advise preventative antibiotics. To help counter cellulitis and other infections, practice these precautions when you have a skin wound. Wash the wound every day with soap and water. Do this slowly as part of your regular baths. Apply a protective cream or ointment. In most superficial wounds, an over-the-counter ointment, petrolatum, polysporin, others, provides adequate protection. Cover your wound with the bandage. Cover the bandages at least daily. Pay attention to signs of infection. Redness, pain, and drainage refer to possible infections and the need for a medical evaluation. Cellulitis treatment often includes prescription oral antibiotics. Within 3 days of starting the medication, tell your doctor if the infection has responded to treatment. You'll need to take the antibiotic for as long as your doctor advises. It should generally take 5 to 10 days, but possibly up to 14 days. In many cases, the symptoms and signs of cellulite disappear after a few days. Therefore, it is advisable to start cellulitis treatment as soon as you notice the start of the infection.